Welcome to TED Ed, a thyroid eye disease educational webinar series brought to you by the TED Community Organization. I'm Layla Lohman, your host of TED Ed. The TED Community Organization is comprised of patients, caregivers, medical professionals, and individuals who advocate for those living with thyroid eye disease, also known as TED. In essence, we're a community of individuals who have a shared living experience of TED. As a dedicated thyroid eye disease 501c3 nonprofit, our vision and quest is to ensure that no one need ever walk alone through the TED journey. To this end, we provide education, support, and connection for all those affected by TED. To learn more about the TED Community Organization and to access our growing list of free services, please visit our website at tedcommunity.org. We are using the TED Ed webinar platform to bring you highly relevant and timely topics related to thyroid eye disease. Each webinar is up to 30 minutes long, packed with practical information to help you navigate the confusing, at times overwhelming, sometimes arduous, and often lonely TED journey. And as an introductory TED Ed webinar, let me tell you about my TED journey as a person who's been living with TED and Graves' disease since childhood. I'm 38 years old and I wear many hats. A few of them I wear daily as a mom, a dentist, a TED patient, a wife, and a friend. My story with TED begins when I was 12 years old. When I was first diagnosed, the early years, I didn't know how to explain things. I was very thin. My mom thought I was anorexic, and she asked if she could take me to the doctor. What happened was they took my blood and the amount of thyroids my body was producing, I was on 12 pills a day to suppress the amount of thyroids my body was producing. And, in sixth grade and seventh grade, getting out of class to take all these medications with a disease we didn't know much about was exhausting. I was actually diagnosed with Graves' disease with exophthalmos. So I was never told I had TED until 2015, which I won't fast forward. I'm going to stick to the plan. And so during those early years, people called me bug eyes. I was made fun of a lot. My eyes looked like this. I have a twin sister who we looked almost identical until eighth grade when I was diagnosed with with Graves' disease. And my appearance changed drastically because of the disease. And I had a very good supportive family, but we all didn't know about the disease and what it entailed. So it was, I don't know, I just felt lost, but it was my normal. And so we moved through the journey of the medication for about 2 years. And then in 2000, my medication stopped working abruptly, and I got bilateral bruises, which means bruises on both sides of my body. And I stopped being able to walk properly because my body was just fighting it. And in 2000, the only treatment options available for me were radiation and surgical intervention. We had to weigh the risks and pros and cons with my family, and radiation had a chance to make my eyes worse and protrude out further. So my mom and I decided together for the surgical intervention. Symptoms back then, I don't know how you could describe it at 12 years old. I have two kids, almost 8 and almost 4. And when they try to describe their headaches or anything, it's really trying to hear their words, see their symptoms. And so my journey from about 12 years old until about maybe 26 to 30 was really, people told me I had severe allergies, I had severe dry eyes, my Graves' disease was managed, and that this is just how we had to manage my eyes. So I just thought everything was normal. And when I was in dental school, I thought I was going blind because I couldn't see the board. And I went to the eye doctor, an ophthalmologist, and he just told me, you have severe dry eyes and I need to be using wetting drops. And they said, oh, if we plug up your tears, it'll put the good tears back. And so we plugged my eyes, my tear duct, we plugged my tear ducts, and it helped tremendously. So I didn't feel blind, but really it felt like sand and eyelash and just craters in my eyes. But sorry about that. But it was really tough just because I thought I was going blind. And sorry about that again. It was really tough because I thought I was going blind and it was really scary. And I'm so glad that the professionals helped me as much as they could. I got LASIK in 2012 and again, did not know I had thyroid eye disease. And it's worked for me. I still have dry eyes. But in 2015 was when I was diagnosed with TED after I got pregnant with my son, Lucas. During that time, I was getting pain and swelling around my eyes, redness, double vision, headaches, light sensitivity, and that was all within the first 6 weeks of being pregnant. I had to go through several professionals who only wanted to treat me with high dose of steroids to manage my symptoms until I found a provider who actually wanted to treat me conservatively because I was pregnant. And as a first time mom, I was scared of what I was putting in my body. And during that pregnancy, it was really tough. I was still a dentist and trying to grow human life. And my thyroid eye disease was at the acute phase where my pain level was probably at a 15, but you still go through life and work and everything. During my pregnancy journey, in my experience, it was really hard because people didn't really believe my thyroid eye disease was very debilitating. And when I went to the doctors, I was explaining to them that like this is really uncomfortable, and I had to advocate to take my son early due to my health being deteriorating, and none of the professionals wanted to take responsibility to have my child early. They were just trying to tell me, oh, you can be bedridden and you could be fine and you'll be fine. And I had to say, like, no, I'm not doing okay. And this is getting extremely worse. I couldn't drive by the 35 weeks, 34 weeks, 33 weeks. And I tried to push through. And when I had my son, my experience with pain, swelling, and redness diminished about 70% just in my, when I had my son. And so I know the inflammation and everything in my body was causing my acute phase to flare up. I think once I started realizing my self-awareness, it's been hindsight's 2020. So I'm able to talk to you at this webinar, thinking back at that time. And I didn't really understand what I was going through during that pregnancy because I was just trying to make sure my son was healthy. After my first child, we were doing selenium and steroids and just a conservative treatment. What I did after that was ask my professionals how likely was this acute phase going to happen again. And he said it was extremely unlikely to happen the first time. Obviously, there's no guarantees, but we can't imagine it happening again. I've actually been pregnant 5 times with 2 live births. And in 2019, I knew I was pregnant because within the time I figured I was pregnant at 4 weeks, I started feeling pain, swelling, and double vision in my right eye. So I took a pregnancy test. Nora came at 36 weeks, again, being my own advocate and talking to the professionals and making sure the baby was healthy and making sure we're talking to the healthcare providers and taking care of ourselves. In 2020, my provider finally knew about a medication which treated thyroid eye disease at the source of the condition. I went through all the red tape, all the information, all the insurance stuff. It was about 3 to 4 months before I could get approved, but the manufacturing company Horizon provides you with a patient access liaison who really was my advocate to help me through the red tape journey of getting the medication. When I finally was approved for it, we had to make sure this was the right decision for us. Me and my husband and my healthcare professionals weighed the pros and the cons, the risks, the side effects, and my condition. And we all made the decision together, an informed decision after getting all the education and opinions, that I would take the medication and see where that led me to. Well, in December of 2020, in the middle of COVID, the Defense Act of 1950, the government stopped the manufacturing of many biologics, and Tepezza was one of them. And so I had 57 days of disruption of service, and we had to make a decision whether we'd be finishing the medication or if I would start it over. We really didn't have the studies to prove anything, and we had to just use our best clinical judgment, my personal judgment with my symptoms. And each infusion, about the third and fourth one, I started realizing I was seeing benefits: less double vision, less pain, less photosensitivity, which is light sensitivity. And I was feeling what a typical person would feel like without thyroid eye disease. And so it was very freeing and exciting for me. So we finished the additional 4 doses. And in July of 2021, I can say that I was 95% better with my symptoms. And for me, it was a game changer. I did have many of the side effects that I'm happy to talk about at a later date, or if you want to email us. But I did have probably 9 out of the 10 side effects. And that's a risk that me and my family were willing to take. And that's a decision you would have to make with your healthcare professionals and the people in your life. So I became a patient advocate in 2020, where I was in some webinars and trying to get the medication. And then I decided to become a part of Prevent Blindness's art therapy program. And the art therapy program led me to connect with so many individuals, 12 who are a part of building this tedcommunity.org, including the founder. And we just noticed that we had such a great connection. And I am not an artist, I'm a stick figure kind of girl. I don't, as much as I am very outgoing, vulnerability is hard for me. I've been going to therapy for 8 years because when I did have my son, he had some serious medical issues that he had to take. He had to have 6 surgeries his first year of life. So I had to get my mental health right. And I knew I was already in therapy. And the art therapy just changed my life to connect me with people who actually knew what I was feeling, and not people just telling me to take Advil or that I had dry eyes. And that connection is what led us to want to build this community for people with thyroid eye disease, so we don't feel alone or lonely. So I've met so many individuals, which the lovely Christine, who's our founder with Nancy, and these women have just, and these people have just changed my life. So I am hosting TED Ed webinars because I want to be a part of everybody's journey. I want to help you. I've been living with this for 25 years. So we want to just share our experiences with you through education and support. And we think an educated person is a smart person, and people who are smart can make informed choices. And I'm just here to give you my experience on this TED journey and be able to ask professionals in a way. As a healthcare provider, I can take my TED patient out and I can be a healthcare provider. I can be a mom. I can be really any hat that I need to be to help you guys through this journey. I want to thank you for watching TED Ed number 1, Layla Lohman's journey, and how tedcommunity.org got started. This webinar is provided for educational purposes only. It does not replace medical care or advice from physicians. It is important to work closely with your healthcare provider to manage and treat your thyroid eye disease. We're here to support you on that journey and give you information that we feel could be helpful. If you would like to submit comments or suggestions for future TED Ed webinars, please email hello@tedcommunity.org. I look forward to seeing you at the next TED Ed webinar.